It's a Tuesday morning. Welcome back to your Feel Good Breakfast show. Now, of course, about 3 days ago, we were celebrating World AIDS Day on the 1st of December. And let's talk about that right now. HIV, of course, a disease which destroys the immune system and makes the body prone to various diseases and infections. Now, according to UNAIDS, 9.4 million people across the world are unaware that they are HIV positive. And the theme of World AIDS Day this year is Know Your Status, which emphasizes the importance of knowing one's HIV status in order to fight against the disease. Now, here to help us unpack the differences between HIV and AIDS what it is and which steps to take and follow once diagnosed as positive is our trusted medical professionals, Dr. Darren Green, and infectious disease physician and HIV clinician, Dr. Emil Reid. Thank you very much for joining us this morning, gentlemen. Thanks. You know, it seems like one of those questions that you would never ask because it's like 2018, there's posters everywhere, there's pamphlets everywhere. How could you not know the difference between HIV and AIDS? But still, a very relevant question so that people gain an understanding of what it is that we're tackling in total. So let's talk about that first, the difference between HIV and AIDS.
Right, so HIV is a virus, just like you get a flu virus and a cold-causing virus. HIV is a virus that attacks the immune system.
Yes.
And your immune system has lots of different soldier cells in it. Whereas AIDS, on the other hand, is a collection of symptoms and syndromes associated when that HIV virus has attacked your system and wiped out many different components of it. You then develop certain symptom complexes that is referred to as acquired immunodeficiency syndrome.
That's what it means.
So yes, so we often refer to the AIDS syndrome or recognize it more readily when we get to the final stage, which is stage 4 of the syndrome itself.
Yeah.
But HIV is the virus itself that attacks the immune system, and AIDS is what the different stages you get to in terms of the symptom complexes associated with that loss.
All right, let's take it one step back and talk about how HIV, the virus or the disease, is passed on from one person to another.
Well, I think traditionally we know it's a sexual route, and that's probably the major route how HIV is transferred. We know it is possible through blood products, although in South Africa we are screening our blood products extremely well, and the chances of you developing either HIV or getting hepatitis B or other viral infections through the blood samples that we do give, the chances are very, very slim. Mm-hmm. Also in America, they have drug abusers, IV drug users, makes up a massive component of their HIV patient population. In South Africa, the majority is heterosexual intercourse, and although HIV previously used to be a homosexual disease, currently it's a heterosexual disease.
Yeah. And of course, as we said earlier on, is that the theme of this year's World AIDS Day is Know Your Status. We're trying to encourage people to get tested in order to know their statuses.
Yes.
But what are some of the symptoms that one needs to look out for if you haven't, let's say, perhaps been tested yet and you're starting to feel a certain kind of way in your body and you're worried?
I normally say HIV doesn't have a face. So it's very difficult to recognize HIV even if you have it.
Yeah.
And the majority of people that do test HIV positive I've never had any symptoms. Very few people do describe an entity that they call seroconversion disease, where they have a sore throat, a skin rash, flu-like illness, and usually because it disappears on its own, they don't go and seek for any help. So should that patient present to a doctor with these symptoms, flu-like symptoms, skin rash, sore throat, etc., what we will do is we will take a sexual history.
Okay.
And should that patient be a high risk for HIV acquisition, we will actually counsel them and test them for HIV. So it's very non-specific. It's very difficult to diagnose HIV purely on symptoms.
Yeah. All right, great insight, gentlemen. Thank you very much. Unfortunately, Dr. Green will be leaving us, but Dr. Reid, you are sticking around for our Tuesday medical chat. We do appreciate it, so make sure that you don't miss out on that. And so we're back again with Dr. Reid, focusing on our medical health chat today, and the topic of which is World AIDS Day, And the theme of this year's World AIDS Day is Know Your Status. We've also opened up our lines on 021-430-9881. And we have a caller this morning, Anonymous. A very good morning to you. All right. We don't have the caller on the line. We'll try and we did get their question, Dr. Reed, so I'll revert it to you. And the question was that the caller is currently on antiretroviral treatment. How often then should they get tested?
Well, the test that they will need is to do a viral load, which tell you the infectiousness of the individual. And normally, if a patient is taking antiretroviral treatment, their viral load should drop to 0 or undetectable level. Once your virus load is undetectable, it means that you will not be able to infect other individuals, whether sexually or not, because you have an undetectable viral level. 2, the chances of you becoming ill due to HIV with an undetectable viral load is very, very slim. And chances of you dying because of HIV with an undetectable level because of HIV is extremely slim.
Yeah.
So what we're looking for in a patient on antiretroviral therapy is to get their viral load to undetectable levels, and usually we test for that every 4 to 6 months to make sure that they stay at that level.
Yeah.
Should it go up on treatment, it means that either the patient is not compliant with regards to medication, or 2, that the patient have developed drug resistance to the medication.
Now, the viral load test that you've just described, is that also the same initial test that you take when you get tested for HIV?
Yes.
All right.
What we do is we do a simple HIV test to decide whether you are positive or negative. The second string of tests will be to decide how far you are within the disease. We call that the CD4 count. And the CD4 count, if it's low, it means your immunity is poor. If the CD4 count is high, your immunity is strong. The viral load on the other side will tell you whether you are going to progress with regards to your disease or not. So if the viral load is high, you are going to progress rapidly, and that is where the ARVs is focusing on. If your viral load is low or undetectable, you are not going to progress with regards to HIV disease at all.
Yeah. We have the National AIDS Helpline on the screen right now, if you'd like to take note of that. Now, let's say somebody's sitting at home and said, well, I got tested last year on World AIDS Day. I was negative. Do I need to get tested again?
Well, I think the important thing is it depends on your risk. If you are living a high-risk lifestyle where you have frequent partners or change of partner, also if you don't use condoms, you are at high risk. If you engage in multiple sex partners or you engage with regards to drug abuse, obviously your risk is much higher. So patients engaging in high-risk behavior should get tested more often, 3 monthly, 6 monthly. People engaging in very low-risk behavior can get tested yearly. And just as an example, Kat, what we normally find nowadays is a lot of people being diagnosed when they go for either donating blood or going for insurance medical checkup. They apply for life insurance, they go for a routine checkup, and suddenly their blood results come back as HIV positive, something that they didn't expect.
Yeah, right. Know your status. That is the theme of this year's World AIDS Day that was, of course, commemorated on the 1st of December. And we'll continue again with our medical chat with Dr. Reed. Our lines are open 0214309881. And, of course, you can call anonymously should you so wish.
It's my feel-good breakfast show.
Welcome back to your Feel Good Breakfast Show. It's a Tuesday morning. We're hanging out with Dr. Emil Reed. Our focus of this Tuesday's medical chat is World AIDS Day, and the theme of which is Know Your Status. We are, of course, during HIV or AIDS Awareness Month. Throughout the month, we'll be talking about this. And a very interesting thing that Dr. Reed just revealed to me that I wasn't aware of, but glad to be able to talk to him about it, is what is called PrEP. I don't know if you've ever heard of PrEP at home, but we'll chat about it in a second. We've got a caller right now. Anonymous on the line. Very good morning, Anonymous.
Hello, how are you?
Thank you so much for the call. What is your question or comment?
Okay, my question is, I wanted to ask the doctor that my husband is HIV positive and I'm negative, and we've been living together for 8 years now.
Yeah.
So I wanted to know how possible is that we're living together, we're having kids, but he's positive and I'm negative. How is that possible?
All right, Dr. Reed.
Okay, thank you, caller. I think the important thing is for the husband to be on antiretroviral therapy. And then the second aim would be for that husband's viral load to become undetectable.
Yes.
If the wife is negative, it means that they can have a normal sexual encounter with regards to having babies.
Yes.
And with the husband's viral load being 0, means that the chances of you being infected with HIV is 0, and the chances that your baby will be infected will be, in fact, 0. So
Okay.
under these circumstances, the most important factor would be that your husband takes antiretroviral treatment and that his virus load is undetectable or 0.
Thank you very much, caller. Much appreciated. Quick question before we get to PrEP, because it's kind of blowing my mind a little bit. How soon after unprotected sex can you be 100% sure that you are clear of HIV?
Well, that's a very difficult answer because, as you know, HIV has what we call a window period. And the window period depends on the test that we use. In some tests where we are testing for the antibodies, usually the antibodies can take up to 6 weeks to develop, which means you can only perform an antibody test, which is the most common used test available, after 6 weeks.
Yeah.
We do have other types of testing where we test for the RNA of the virus, which we call the viral load. And under these circumstances, we can perform it after 2 weeks. Okay. So depending on which test you use,
yes,
you should test after 6 weeks, and again after 3 months, and to be 100% sure after 6 months.
Okay. Very quickly, we have to talk about PrEP and what it is.
Well, PrEP is what we call pre-exposure prophylaxis. What antiretroviral treatment means is, one, we can give it to people living with HIV, and under these circumstances, we call it HAART, which means highly active antiretroviral treatment. The second component to antiretroviral use is where we use it as post-exposure prophylaxis, so-called PEP, where people that are negative have a needle stick injury, whether in the medical setup, and we provide them with antiretroviral treatment as soon as they had the needle stick injury in order to prevent them from acquiring HIV. The third prevention strategy is so-called PrEP, which means pre-exposure prophylaxis, and those are for individuals who are HIV negative, who are living a high-risk lifestyle with regards to acquiring HIV, and we have various ways of starting them on antiretroviral therapy, either daily, every 2 or 3 days, or pre and post the sexual encounter that will prevent them from acquiring HIV.
Wow. Thank you very, very much. So much to take in and to understand, but we do appreciate your time and expertise, Dr. Reed. And once again, the National AIDS Helpline is on the screen right now, 0800 021 322. And make sure that you go out there, wise up, and educate yourself on these matters.